Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice.
Hi, everybody. Chad Madden here with the Grow Your Practice podcast. And in this episode, we're going to be talking with Matt Vanderkooi. And Matt is not only a practice owner, but also is involved with SolveGlobal. We're going to explain exactly what that is in a second here. We're going to talk about how Matt came to the podcast. It was a mutual introduction from Paul Welk. Many of you know Paul Welk as he's been on the podcast a few times, but I was asking for somebody who was successful in going to employers. And Matt, it seems that you have the model, exactly how to do that. You've also incorporated it into your private practice. So welcome to the podcast here.
Well, thank you very much, Chad. Appreciate being here. And even before we get started, just want to say thank you for what you've done for our profession. One of my business partners took Killer Marketing with you back several years ago. And that started us along the lines of becoming less dependent on physician referrals in our clinics. So I just wanted to, say that initially. Thank you for what you've done for a profession. I think it's essential what you've done to decrease that dependency. So I just wanted to say thank you for that.
You are welcome, and thank you for implementing, which is the best part, is that we're so much stronger when we're all doing it together. How did you get started with New Life Physical Therapy? I know you've been in practice for 20 plus years, Matt. Can you talk a little bit about how you became a PT, how you got started with private practice as well?
Yeah, absolutely can do that. Yeah, my interest in physical therapy started way back when my dad had a knee injury, actually. He said, hey, you should check this profession out. I think it's pretty cool. So I went and I saw what they did with him in therapy, and then I went, boy, this profession's pretty cool. You can use your brain, you can use your hands, you can be physically active. It seems like it might be a good fit. So I started taking the courses. Got a job as a physical therapy tech one summer and confirmed that physical therapy was where I wanted to go. So got into the profession way back in the 90s and have enjoyed growing in the profession ever since.
That's great. So are you originally from Wisconsin?
Actually, originally from Michigan. I've been a Wisconsin transplant since 96, I think, is when I moved to Wisconsin.
Nice. And then you got out of, you graduated from PT school, and then how did you get started with private practice and New Life?
Yeah, so my first job, what I was really looking for was actually a place to be mentored, which is not uncommon for folks today, right? We want to be mentored. So I was trying to find a spot to be mentored. I wanted to grow as a manual therapist, first of all. So I found a hospital-based system where there was some really cool people that worked there. Problem was, shortly after I got there, they all started leaving. I couldn't figure out why. Why is this? So I was there for about, in all, about 6 years, but the disillusionment started to set in year 4 and 5 when I realized that at that hospital, it was a nonprofit, actually. It really became very apparent it was more about the facilities and the dollars than it was about patient care. And I really got into the business of physical therapy because I thought it was a cool profession, but ultimately using my hands and my brain and being physically active, I can make a difference in people's lives and help them get back to what they want, love, and need to be able to do. So that's why I got into it. And I was really finding in the hospital-based setting, I wasn't able to give care the way I thought it should be delivered. So back in 2002, made the leap. A little 1,000 square foot practice in the middle of town. A little building cost me $600 a month, and went to it. And it was kind of weird. From a marketing perspective, I thought, I just opened the doors and people would come. It was weird. It didn't happen that way.
Yeah. The just out of curiosity, did the hospital, the healthcare system that you came from, did they have, they had their own PT. Did they have their own outpatient facilities as well?
Yeah, they did. They had a brand new, it really, when it was, the PT facility was initially in the in the hospital, this older hospital, and it was really great because it was really about people and making a difference. But then they built a new outpatient medical facility where they put physical therapy in. And there was a transition in culture where it really became about the buildings and the money. And that's when it really went south. It's interesting.
Yep. Fair enough. I appreciate you sharing that story, Matt. I want to next ask you about SolveGlobal. And I know you got into that fairly early within private practice. Can you talk about the problem that you were seeing within your practice or within the industry that ultimately led you to co-found that, and exactly what it is?
Yeah. So I started practice in 2002, and actually it was a year in, I really realized there's a lot of people that weren't getting to physical therapy, either in private practice or even to the hospitals. And these people were in companies. And what was keeping them from coming to physical therapy, they had deductibles even back then. And a lot of it was they didn't know what physical therapy could do, was another problem. And I really realized that there's a whole huge population of people that we're not reaching in our clinics. And there's a little different reason for that today than it was back in 2003. But I figured if I'm going to give help to these folks in these companies, I need to go to where they are. And I actually met my partner in SolveGlobal back in 2003, and he worked back in the 90s, 80s and 90s even, with companies like Ford, Mazda, U.S. Steel, Herman Miller, companies like that. And he was pioneering some strategies there to take care of people with musculoskeletal disorders. I met him in 2003, and we started to take his strategies and we started to evolve them. And we started to add technology to these strategies. And we started implementing in 2005 with our first company as SolveGlobal. And we've been basically building, evolving ever since. And SolveGlobal exists basically to maintain people like machines are maintained. We actually maintain people and protect them. And by so doing, we protect employers' profitability, and we actually help them maintain people, retain people instead of lose them because they hurt. So it's all about comprehensive musculoskeletal care to maintain and protect people.
Okay. So I want to stay on that for a little bit. Your first customer, you went into a large employer. Was it blue collar work, white collar work, combination of both?
It was a combination of both. It's in the glass industry. It was our first company was actually in glass. Cardinal Glass is the company that we started with in 2005. They make the windows they make the glass for windows like Anderson and Pella, actually. And a lot of people were doing material handling. They were doing fork truck driving. They were, but also doing a lot of desk work and computer work as well.
Okay. And then the services that you were providing them, because I know for many employers, a workers' comp claim is devastating, right? And costs the company a lot of money. So you were going in with a solution as a physical therapist with SolveGlobal, and you were helping maintain the health of the workers, right? The musculoskeletal health of the workers. And you were doing that. Where were you? What exactly what services were you providing them at?
So kind of our niche and our value proposition for companies is we developed a tool to find risk in the populations before the claims actually would happen, either in group health or in workers' comp. So we would find risk in populations. So we would look at this company and we'd be able to tell them that your A shift cold end workers have your greatest risk right now for low back claims, and it's related to reaching. So we can find that risk, and then we can strategize with them and how we can decrease that risk. And decreasing risk is all about improving the match of the employee with their task demands and the environment they're doing it in. So we would find that risk either by populations and by individuals, and we could reach out to people before they would get into the health system, seeing the doctors, the ERs, and urgent cares. And we'd actually reach out to them because we'd find them with our predictive analytic tool, and we'd be able to say, hey, can we help you? And that's really a big deal. One of the things that is a challenge in provider world is human behavior. And Clayton Christensen, the late Clayton Christensen, when he was talking about innovating healthcare, he mentioned that we have a problem with our healthcare, and there's a lot of problems, but one of them is actually human behavior. And he said that only 20% of the population cares about their health all the time. 80% only cares when they're sick. So if we just put a provider on site and they sit in an office or they're here, a given day a week, it's 20% of the population that's going to use that service because they care about their health. 80%, they're not going to utilize that service. When they start to hurt, they're going to think they're sick and they're going to go to the doctor, which they've always done. We've got to break up that cycle of doctor first to physical therapy first. And to do that, we've got to get to them before they think they're sick. So that was a big premise that we built our system on, is to interact with people before they get out of system into the health system, which we know is fraught with waste and overspending.
Yeah, that's great. And just to double back on Clayton Christensen, you're referring to the Innovator's Prescription, I think is the name of that?
You got it. You got it. And so he wrote the book Innovator's Prescription, which is fantastic. And he actually, that 80-20 that I just talked about, he was talking to Mayo when I first heard that. It was very interesting. That was one of the big things he talked about. And then he also brought up the point that for every $10 a community health system takes in, they spend $1 on patient care. So that was another thing he said in that talk that really inspired me to say, hey, we've got to do this different. We've got to do this better. We've got to bring care outside of the traditional healthcare systems and do it in a better way.
That's great. It's funny that you brought that up. I had read the Innovator's Dilemma and Innovator's Prescription years ago, and then just recently grabbed it again was looking at my notes, and I can't believe you brought that up.
Good stuff, isn't it?
Matt, you mentioned a predictive analytical tool. What were the, and before we get into the relationship that you have with the employers there, what are the inputs in that? Can you give us like a general overall prescription or description of what that would look like and how you're doing that? Because, it's easy to get overwhelmed in the data and looking at that. So is there like a biomechanical analysis component? Like, how are you doing that?
Yeah, so we have an app actually. We've gone to an app. Initially we started just very analog, but now we have an app where we basically are checking in with employees, and we're finding out where and when people are having comfort and performance issues. So they'll let us know if they're having a comfort and performance issue, and then we have an algorithm that lives behind our check-in with employees that assigns risk. So we can basically stratify risk in populations as well. So I can see one person is closer to an expensive claim than another, and I can follow up with that individual. So we have an algorithm that lives behind a check-in that will allow us to stratify risk in populations and prioritize. So that's the input. And then we also then work with providers that are able to rebalance a person. When we find risk, we got to mitigate that risk. We have to mitigate the risk. And the risk is always an imbalance between that individual, their task demands, and the environment. And it's our job to rebalance that. And physical therapists are uniquely trained to be the profession to do that rebalancing. That's what's exciting about our profession, I think.
Nice. And in your model with SolveGlobal, is it primarily, are the treatments or the interventions primarily within the workplace, or are they more so within your clinics?
So one of the things that we've kind of explored and we've worked to build is a model that we think is most effective now and going into the future. And I really think it's a hybrid model where it's not all on site, it's not all in our clinics, and it's not all online either. But we have to be able to reach people where they're at. And I really think that we need to be able to reach people online, on site, and near site. So that's our delivery model is a blend of those things where we are able to leverage technology, but also utilize our unique skill set. I think some of the bigger players in the space of musculoskeletal direct to employer, they're looking to do it all online or all virtually. There's a way to scale that very quickly, but I also do think that misses some of the things that we are uniquely positioned to do face to face. So I think we need to have online tools, and we built one of those as well. We have an online tool that allows us to work online, but there's something special about the hybrid approach, I believe.
Yeah, I agree with you. And just literally the last guest we had on the podcast spoke in a very similar way, where they have an online treatment model, but oftentimes, the person's coming in for a live visit as well to complement that. So appreciate what you said there. So next question that I have for you, Matt, is obviously you're very in tune with how employers are thinking about human maintenance, for lack of a better term, and especially musculoskeletal maintenance. What are trends that you're seeing in today's marketplace that are relevant? If I'm a private practice owner and I don't have this set up, how do I think about mitigating those trends, or really, selling my services to an employer? Can you talk a little bit about that, about what you're seeing?
Yeah, I'd be happy to. I think as a private practitioner and as a physical therapist, I think one of the biggest frustrations for me is the trend that we're seeing now, and we have for a long time, which is the physical therapist being on the back of the train, the caboose, so to speak, where we get folks after they've exhausted every other option, right? And then when they come to see us, things are chronic and hard to get better. So we find that physical therapists traditionally have been put in a box of doing rehab therapy. And I think that the trends that are becoming more available now are the trends that allow us to do it much more, because employers are seeing that they've got to get a handle on their healthcare costs. One of the interesting things trend-wise on that is, before COVID, when we were in the 2018, 2019, healthcare spend was going up almost exponentially, and people were looking for solutions. COVID hit, and it became just stay open. Then we started to have supply chain issues. After we came out of COVID, people were really worried about supply chain issues. But now what we're seeing is a trend where employers are really realizing we have to retain our people. And what's happening is that healthcare costs are starting to go up exponentially again, at a rate of 10+% on a lot of premiums that employers are paying. And what's also interesting right now is employers are no longer able to handle that increase in cost the same way they were even 5 years ago, which was, well, let's just shift more costs over to the employee. So they would do that via higher deductibles, higher copays, higher premiums. But what's happened with that is that way to control costs has been exhausted. Also, with the shortage of workers, employers need to take better care of their people to retain them. So they are really in a position where they need to change their healthcare benefits as usual, and really, actually, truly now take better care of their people. And if they do that well, they can lower their costs. So I think we're in a time of opportunity in regards to the employer mindset, with their stressors and being able to respond to that. So I think that's exciting. I think in the clinic side of things, I think we have some pressures that would say, hey, we should go after this opportunity. And some of those, those stressors and trends that I'm seeing, the declining reimbursement that continues to happen, right? We see that continually happening with Medicare. And another trend that's happening is employers, when they become self-insured, are basing what they're going to pay for services based on a percentage of Medicare. So as employers are putting in self-insured health plans, those rates that those health plans are paying is going down along with Medicare. So in the traditional model of rehab therapy, delivery dependent on insurance, we're seeing a pressure of declining reimbursement while we're having what we all have seen with the inflation. So we need to come up and say, hey, we've got to find different revenue streams, better revenue streams that are outside of the compression of insurance, and also outside of the administrative burden of insurance that we all know so well with prior auth and such. So I think we're kind of in a time of a bit of a perfect storm of opportunity here, where we're being pushed to do something in our practices, and the opportunity is there because employers are looking for solutions. So I really think now is a really good time to go after this opportunity, these new revenue streams that are there for us.
What are some of the biggest opportunities? You mentioned employers, Matt. What are some of the biggest opportunities you see in the marketplace today?
I see some of the biggest opportunities is direct to employer and direct to consumer. I think those two pieces. On the clinic side, we do have people with high deductible health plans. So when they have those high deductible, they're going to be looking for more economical models. And in the other thing that's happening is healthcare systems are charging so much for physical therapy. I may not be popular here when I say this, but I do not think all physical therapy is good value. And I say that because I see hospital charges that are as high as $1,000 for their first visit. And I can't tell somebody and look them in the face and say, okay, I think that is the best value for you right now with your low back pain, your acute low back pain. So that opportunity creates that environment is creating opportunity for us in private practice that can put out a better option for price outside of our traditional clinic walls. But I think also, that employer opportunity where that employer is trying to invest in the right things for their people. And what they're really, the best things for them to invest in their people is a plan that emphasizes primary care. And there's a niche in primary care that we've missed out on, and that niche is musculoskeletal primary care. And we should be doing musculoskeletal primary care population health management. And that's what we tools for. That's what we should be offering for employers, because we all know that physicians are not trained to be able to provide musculoskeletal primary care. They're trained to order injections. They're trained to order images, and they're trained to prescribe and refer. They're not trained to get to root cause. So I think there's a huge opportunity right now in regards to that musculoskeletal primary care and population health, where we can go beyond being rehab therapists, and we can really actually practice at the top of our license. I think we have just incredible opportunity to do that right now.
That's great. And only because you put yourself out there and you're vulnerable, and the not all PT is the same. I'm going to back you up here. So I have EOBs from our patients who have gone to the healthcare systems in our area. Also, somebody from your neck of the woods, you mentioned Michigan. So I know I have an copy of an EOB from Michigan, and it's a 4-unit visit, first visit, an eval. The one that I have from here is a $1,200 charge. The one that I have from Michigan, I think, is higher. I think it's same. You said $1,000, but I've seen those charges. And then in both cases, they were reimbursed for a 4-unit first visit. So that's like an eval, a TE, maybe a neuromuscular re-ed, and maybe a gait training or something like that. But a 4-unit visit that I think our average is 102 is what we would get reimbursed. Maybe it's a little bit higher for the eval. But in both of those cases, it was over $300 and just only looking at your CV of what I can see, you're an OCS, you're fellowship trained, lots of meaningful letters to me after your name, Matt. I'm pretty sure if I had back pain, I would much rather come to you or see one of your therapists than go to the routine healthcare system. That's just me though. But yeah, thank you again for putting yourself out there, and I think you're in good company. So you get to talk with a lot of employers and build relationships there. Can you talk through or comment on like how they're thinking about creating value for their employees without increasing their expenses? So I know there's a narrative that goes with that. I have friends in the call it preventative health space that work directly with employers. And I know many times we're surprised to hear like how employers are looking at not really cutting their costs, but getting more mileage out of their employee investment?
So that conversation is a difficult one to have, actually, and difficult to navigate. It's been much harder than I thought. As we've been working on selling this strategy for 15 plus years here, the reason the conversation is so difficult to have is because employers are so used to not being able to do anything with their health insurance, and they trust the brokers, and the brokers are saying, well, there's really nothing you can do, but let us negotiate this 10% increase down to a 6% increase and let us take care of you. They're so used to doing that and taking their healthcare expenses and saying, here you go, broker. I trust you, and you're the person that can handle this for me. And the problem with that is that the broker is not only getting paid by the employer, the broker's also getting paid by the insurance carrier in back end dollars coming back to them and overrides and such. So the broker is getting paid by the insurer to sell the insurance product to the employer, who's also paying them. So the challenge, one of the biggest challenges, is navigating that long-standing broker-employer relationship. So there's an art to that, and there's an art to helping the employer understand their problems, and helping the employer understand that there's a solution outside of traditional healthcare for their problems. And I do think we're in a time where employers are willing to listen to this more. But it is challenging, that narrative of helping them see that there is answers outside of traditional healthcare, because many are still listening to the traditional broker. So it takes a bit of caressing to work that through.
Cool. You've been in the private practice game for a while, Matt. What are some of the biggest ways, especially more recently, that you've seen the profession hold itself back?
Oh, that's a really good question. I think my first firing, the first shot I would fire would be at health systems. I think what health systems are charging for physical therapy is killing our profession. I mean, we're trying to say physical therapy is high value when people are getting these EOBs. That is holding us back. And I heard this 10 years ago, physical therapy is too expensive. And it's not physical therapy in private practice. We're the best value out there. It is physical therapy in the health systems. And actually, for us, Chad, in Wisconsin, where I'm at now, grew up on the other side of the lake, but where I'm at now in Wisconsin, we see EOBs coming in $600 to $1,000, and we actually see them being reimbursed at sometimes $500 to $600. They're getting 60 to 70% of what they're billing in these health systems.
And that's a single visit.
Single visit.
Yeah.
So I think that's the biggest thing holding our profession back, is that cost. I think other things that are holding our profession back is a mindset, that we can provide the most value in our clinic, behind our clinic walls. I think we need to be willing to step outside of our clinic walls, and we're able to deliver so much more than simple rehabilitation therapy. We are trained to be the musculoskeletal primary care provider. That I think we can be that provider, but we've got to change our mindset and say, okay, we're going to step out of our traditional mindset and clinic wall to do that. The other thing I think that has held us back is actually is still the rehab therapy mindset. And I think we built our professional model on that from our APTA guidelines of documentation. It's built on rehab episodes. And musculoskeletal primary care is not a rehab episode. When we're working with employees, I actually get to work with people from hire to retire. I've been able to high five people, and I work with them a little bit here, a little bit 6 months from now, a little bit 2 months from now. And we just keep them going, keep training and teaching and helping them fit their tasks. So we're alongside people on their journey of life, as opposed to you come in and see me for an episode of therapy and then you are on your way. So we built constraints in our documentation around, we have to do a plan of care with, a frequency, a duration, long and short-term goals. Well, I'm working with people over their lifespan, not to rehab a surgery. So it's a different mindset that I think we need to have. We need to love rehab therapy, but let's also do musculoskeletal care. Let's do our musculoskeletal primary care. Let's also do training, personal training for people, moving them into Health Plus. Let's work with people with chronic degenerative conditions and keep them going. So I think we put ourselves in a rehab therapy box that I think we need to get ourselves out of. So those are the mindsets I think that we need to change. I also think it would be helpful if we, instead of trying to protect our profession, and just be happy with protecting and holding our whatever we do, and not let anybody else do what we do. I think there are protections that we need to do. Don't get me wrong, but I think we need to, instead of try to hold everything in, we need to reach out. We need to look how else we can use our skill sets out there in the world to help the marketplace, to solve the marketplace's problems. I think that's how we can create incredible value.
Yeah, I appreciate what you said there. I know very recently I was listening to, I believe Peter Attia was just on Andrew Huberman podcast. So Peter Attia is a longevity, I believe an MD out of New York. Focuses primarily in longevity, has, I think, the Drive podcast. Andrew Huberman is a neuroscientist, neuro-ophthalmologist from California, has a pretty interesting podcast. And they were talking about how they do the Centenarian Olympics, like, in order for you to be active and have a healthy life at 100 years old, here are the things that this is where you should be when you're 50. This is where you should be when you're 60. And they have a lot of data and discuss that research. But when I was listening to that, the thing that resonated with me, Matt, which you just essentially said in another way, or at least alluded to, is nobody is in a better position to optimize musculoskeletal health than the physical therapist. But we do niche ourselves down to, well, I can see you when you have a musculoskeletal disorder and a loss of function. And that is the only time that I can ever work with you. And I, again, appreciate what you said there. Other than that and the opportunities that you just mentioned, is there anything else that you see with regards to, like, looking at the last 20, 25 years in practice, and then also looking forward to the future? Any other direction, any other opportunities for growth, anything like that you see with regards to private practice PT?
Yeah, I think those are pretty much the big ones. But I also think there's other opportunity to tap into the non-traditional healthcare delivery sector. And what I'm talking about there is the lifestyle medicine folks. We're a perfect fit to work with the lifestyle medicine groups because we're all about physical activity and lifestyle. So I think there is a way for us to align ourselves outside of the traditional healthcare system as well, and get other non-traditional referral sources. And you kind of reminded me of one other thing, Chad, when you were talking about musculoskeletal disorders. That musculoskeletal disorder space is one that you didn't really hear about 10 years ago unless there was a company that was trying to solve a work comp problem. And which is kind of weird because musculoskeletal disorders are actually the number one chronic disease in group health benefits as well. You have MSDs, cardiovascular conditions, cancer, diabetes, obesity, and depression. So MSD is the number one cost there, but it's only 20% of the total cost. So it's not given the press, so to speak, there. And then because because employee benefits are different from work comp, the true cost of musculoskeletal for companies is siloed in these different areas of the company, so it's not really appreciated. But what I think is such an opportunity, if we fix musculoskeletal disorders, now we can get people physically active so we can lower the risk for cardiovascular disease, cancer, diabetes, obesity, and depression. I think we have such a gift to bring to the population. And another thing was interesting. If you look at the bone and joint burden study and their website, they would say 54% of the population has an MSD at any given one time. And we in our profession, the most generous statistics I've seen are that we may see 8 to 10% of the population, and I think it's probably lower than that. And so we have I'm not forgetting the math here, but we have a big percentage of people we're not seeing. So I think that's a huge opportunity for us.
Yeah. Quick math off the top of my head is we're not even seeing 20% of the available musculoskeletal MSD patients.
Yeah, that's my math as well. 80% of folks we're not seeing.
Are you a practice owner with a growth mindset? You're looking to grow your revenues, leave a bigger impact, build a legacy, and help more people in your practice, yet at the same time, you're dealing with the big challenges and headwinds like declining reimbursements, increased cost of doing business because of inflation, how to incentivize your staff, or deciding where's the best place to run your online ads. Growing a practice can be absolutely overwhelming. To help, Breakthrough has put together a unique offer that I think you'll be interested in. For a limited time, listeners of this podcast can schedule a risk-free growth consultation with a Breakthrough growth expert. On that call, you'll walk through what you're currently doing in your practice and what you could be doing to increase the demand for your services. Breakthrough's mission is to help people overcome their health challenges naturally, and the best way for them to do that is by helping private practice owners just like you through building more demand for your services. Go to breakthrough.com/podcast offer to take advantage of this unique opportunity. On that call, you'll learn the key principles of how practice owners are helping more people, creating a bigger impact, and building better businesses with Breakthrough systems. As an added bonus, the team at Breakthrough is giving a $50 Amazon gift card to any of the podcast listeners who attend the growth consultation. Sign up for your growth consultation and $50 gift card at getbreakthrough.com/podcast offer. Again, that's getbreakthrough.com/podcast offer. We did not talk about this beforehand, but I would love, so let's say I have a private practice, which I do, and I'm saying, okay, we're going to do direct to employer, which we have had some success with, whether it's workers' comp or, looking at MSD from a preventative standpoint. How would I even start? How would I even go about doing that? And are there any pitfalls, major mistakes, lessons learned that you've had, Matt, that you can just tell me, not reinvent the wheel?
Yeah.
Doing
so I can tell you some of the mistakes I've made. The big challenge, first of all, is being able to market and sell it. You've got the marketing down. The selling it is also a challenge. To be able to understand that every different person in a company has a different problem they need solved and has a different language that they talk. So if I'm talking about to the safety manager, they've got a different problem they're solving than the HR director, than the CFO, than the CEO. And each one talks in a little bit different language. And what's been a challenge in selling direct to employer is it used to be that companies were very top-down driven. Now the org chart is much more horizontal. So it's not as simple now as getting a CEO to say yes, and now it happens. Because org charts have gotten flatter, you need buy-in at every level of that company. So the sale has become much more complex. So you need to understand complex selling. It's not as simple as finding a key decision maker and thinking it's done. So that would be one thing is understanding the complex sale process. Another is that we need to be able to talk the language of business. And we also then need to think that our mindset shifts in regards to compliance. So the employer is worried about different compliance than we are in our clinics. In our clinics, we have insurance, we have We have Medicare, we have 8-minute rules, we have CPT billing guidelines, we have all these things that we think about with compliance in our clinics. In the employer space, we need to understand compliance around OSHA. We need to understand compliance around IRS guidelines for free medical care with high deductible health plans. We need to understand ADA, we need to understand HIPAA. So we have to go in with an understanding of these things, because if we don't understand these things and if we're not compliant with these regulatory bodies in the employer space, we can hurt our profession, because I know that there's folks that have caused OSHA compliance issues, IRS compliance issues, HIPAA compliance issues, and then it sours that employer on ever trying again. So we need to understand those things. We also, another thing that's really important is in the employer space, the trust that you have with the employees is so very important. So how you handle confidentiality and how you navigate what you're there to do. You're not there to be the employer's doctor of physical therapy. You're also not there to help the employee do whatever they want to get out of doing what they don't like to do. You're there to give people all the right care that they need at the right time and for the right price. You're doing all and only what's needed to take care of people. And when you do that, it lowers their costs and it lowers the employer's costs. So those would be some of the things that are pitfalls that I have seen. So hopefully that's a little bit helpful.
Yeah, that's great. So with SolveGlobal, are you helping other practices with this, or is this just something specifically for your clinics?
Yeah, so a little bit of this story of SolveGlobal. So SolveGlobal, we started to build this system back in 2003, and we started to pilot the system or beta test the system at New Life Physical Therapy, my private practice. So we started beta testing this thing with employers in the Wisconsin region. And then it was all about, okay, can we validate what we're doing? So then we went to the next step and we said, okay, we got to collect outcomes. We got to validate what we're doing. And we were able to then actually take what we were doing and we got it validated by the Validation Institute, where they look at your outcomes and say, okay, do we believe you're doing what you say you're doing? So that was kind of cool. So we're building it up to the point where, okay, let's build it, let's validate it. And then we were like, okay, how can we help more people in the profession do what we're doing? So we actually started to partner with different private practices for using our system. And they could use our system with employers. And what we found that the private practice owners and their therapists were having a really difficult time selling it. Selling it was very difficult, and then making sure that the relationship on the employer level is being handled correctly. And we also found that we were kind of fragmenting the market a bit. So we made a decision about a year ago to say, okay, what if we did a plug and play solution where we as SolveGlobal took care of the sales. The sales part of it, we took care of the relationship management, we took care of the training and the implementation and the systems, and the provider could then just go in, use their skills to solve the problems that we identify. So we're actually working on bringing this thing out nationally, and if a therapist has a relationship, we'll talk to the therapist and say, hey, we'll help you turn that relationship into revenue, and we'll help you deliver care at a higher margin than you're getting in your practices. So we've really went from a very decentralized focus where we're saying, here's our tools, here's our training, go. We really found that wasn't really working over the last decade in regards to people being able to sell it. So we're actually taking things centrally, and we're doing a plug and play and doing everything for folks. Just recently, I had a colleague of mine out of the Milwaukee area give me a call and said, hey, I've got a relationship with an employer here. They're asking if we can do on-site services, and I have never done it before. And I said, well, if you want us to do it together, we can do that. And we came in And we sold the contract. We actually got a turnaround of this thing in about 2 months. We're going to be implementing 5.1, and he's going to be delivering the services, and he's going to be making a much higher margin than he is in his clinic. So we found a way, I think, that will allow us to come up with a centralized strategy that's non-fragmented, that allows providers to plug and play and do what they do best, because selling is very difficult.
Yeah, completely agree with you there. So for owners that are listening to this right now, what's the best way for them to learn more about SolveGlobal or to get in contact with you, Matt?
Yeah, if they go to SolveGlobal.com, they'll be able to kind of see what we're doing. They'll be able to see kind of the validations. They can reach out to me at Matt, MATTV, at SolveGlobal.com, and we can have a conversation. I might be able to help.
Great. I'll put both your email and the SolveGlobal URL in the show notes here. One more question for you. In the prep here, you mentioned the MSK calculator.
Oh, yeah.
What is that?
Yeah, so we developed a calculator that we put on our website. If you go to solveglobal.com, you can actually see the financial implications of musculoskeletal costs for employers with different employee sizes. So you can plug that in, and we base that basically on Milliman's data, and also data that we were able to get from Optum and Aon. So we built that calculator off of those benchmarks so that an employer could actually put their 1,000 employees in there, and they can actually see what they're going to waste on musculoskeletal spending over the next 5 years.
Got it. So I just clicked on the site. I found to estimate your MSD overspend, number of employees, zip code, total annual health spend. That's the calculator.
Yeah, and that will give them an idea. So one of the things also, Chad, you mentioned earlier some of the challenges. One of the challenges that is there is employers don't always have a handle on their data. We thought they did years ago, but they don't always. So because they don't have a handle on their data, they don't even know how big of a deal musculoskeletal disorders is. So that's where that calculator comes into play. It can help show them that this is the impact this is having on your spend. So that is kind of an interesting phenomenon.
Very cool. Well, Matt, this has been amazing. I'm reminded of the original conversation that I had with Paul, and he had mentioned going direct to the employers. You definitely crushed it here, shared a lot of information and decades of experience. So thank you again for doing this. This was great.
Hey, my pleasure, Chad. Thanks for hosting me, and thanks for all you're doing out there.
Remember to visit getbreakthrough.com to access our free resource library designed specifically for private practice growth. While you're there, make sure you register for a complimentary growth assessment to learn about potential opportunities for growth in your local market. Again, thank you for tuning into the Grow Your Practice podcast and supporting our mission to help people in pain get back to normal naturally.